Hi, this is Pat McDonald, your host for Vote for Vermont, where our tagline is listening beyond the sound bites. Joining me tonight is Ben Kinsley, who's the Executive Director for Campaign for Vermont, also my co-host and co-producer, and Jolinda Laclair. Jolinda was just tapped by Governor Phil Scott in January to serve as the State Director of Drug Abuse. Quite a title.
Very nice to see you, Pat.
Yes, thank you.
Nice to see you, Ben.
Yes.
So, the Director of Drug Policy, I'm just going to read this thing. Why you said yes is another story. The governor shall designate a Director of Drug Policy who shall act as the Executive Director of the Council and who will support, coordinate, and monitor the progress of the Council on a day-to-day basis. And that's going to be a discussion in just a few minutes about the Council and who's on it and how it all works. But first, we always ask our guests to talk a little bit about themselves.
Well, thank you, Pat, and thank you, Ben. And it is really good to see you.
Thank
I think
Yes,
you and I met a number of decades ago.
Yes, and in a few hats both of us wore.
We certainly
Yes, we did.
We certainly did. State government, legislative branch, you did.
Yep.
And I served in the executive branch for the federal government as well. So I've had a very amazing career here in the state of Vermont. I landed here when I was 11, and I graduated Stowe High School, went on to UVM, got a degree in sociology, which was a great foundation for anything that you want to do in life. And then I landed in Middlesex, Vermont, and raised my family. Went to work for then Congressman Jeffords, who became Senator Jeffords in 1988. I started out doing casework. Anybody who has a problem with a federal agency or program, I helped cut through the red tape, whether it was Medicare or Medicaid, and I feel like I'm coming full circle again.
Yeah, it's back.
It is back. Or veterans issues, business, the environment, agriculture. So it was a tremendous opportunity working for an individual who believed that good policy is the way to serve people and communities the best. And I've tried very hard to practice that over the years. In 2001, Senator Jeffords nominated me to be the State Director for USDA Rural Development for Vermont and New Hampshire. And he did happen to leave his position as a Republican shortly after I took office and became an independent. I was very fortunate to remain in my role. And so I oversaw the operations, the personnel, delivered a lot of money, which were critical resources to community and economic development, affordable housing.
Yeah.
A lot of community facility activity, programming up in the Northeast Kingdom and the northern tier of New Hampshire in particular, very rural areas, areas where the challenges that we know which face rural communities of childcare, transportation, access to employment, and quality health care all still exist. However, those programs do make a difference. And then in 2011, I went on to be the Deputy Secretary of the Vermont Agency of Agriculture, Food and Markets under Governor Shumlin.
Right.
And that was an incredibly exciting, exhausting
Who was the
6
secretary?
years. Secretary was Chuck Ross,
Oh, what a
who was
team.
the State Director for Senator Leahy for many, many years. And he's now gone on to UVM Extension. So I suppose it makes the point that many of us in Vermont are focused on good policy and better program implementation. Those 6 years were hard. We had Tropical Storm Irene, which we just had the 6th anniversary of that in August. That happened in 2011. We also had numerous floods. We had significant challenges in Lake Champlain. The positive side was that we had a farm to plate initiative here in the state, which is alive and well, and we look at all the value-added manufacturers, whether they produce cheese or they produce craft beer or they produce grass-fed beef. And Vermont is known, as we see all the tourists who are here right now doing a great job fueling our economy. Part of it is the agricultural landscape.
Right.
This
We had Ensign
landscape.
on. It was a great show. And the governor just signed an executive order for farm to school, which is another great program to make sure our children understand about fresh foods and
Yes.
what we grow in our backyard. I know we don't have all that much time. One quick story. 150th anniversary Civil War. We went down to Cedar Creek. Joe Benning came down and Howard Coffin to present the people there with a plaque to represent Vermonters, and it's the actual duplication of the plaque that's in the Cedar Creek room.
Yes.
They had a moment of silence to honor Senator Jeffords. There wasn't a dry eye, including mine, in the crowd. It was so emotional because he, unbeknownst to many Vermonters, gave a lot of money to Cedar Creek and to other battlefields where Vermonters were active and made a difference in the war. You would have it was amazing.
And Howard Coffin was the catalyst for that connection.
Oh, yeah,
Yes.
they love him down there. Sorry. But when they said they were on a moment of silence and then said why, I had no idea. So anyway, it was really great. So let's move on here. So the governor made a campaign promise to reduce the number of Vermonters addicted to opiates, and you said yes, not too much pressure. So what is your goal? Obviously you want to meet the governor's goal, but you've been on board now, what's 5 months, 6 months?
About close to 9 months.
Is it done yet,
Close to 9 months.
What's final plan? We're in the home stretch, right?
Well,
Yeah.
we are actually in the home stretch for a first set of recommendations. It seemed very important as Governor Scott highlighted the challenges that we face across the state with opioids and substance use disorders in general. I mean, they will likely never go away. That doesn't mean that we as state leaders cannot do more to affect change, and we can. When the governor issued the second executive order, which not only established the Opioid Coordination Council,
Right.
as well as my position as executive director of the council and director of drug prevention policy.
Right.
I'm learning the correct terminology
Very nice.
for so many of these critical pieces of this work. We knew that it would take a long time to implement changes in programs. We're talking about systemic change because we can look at 4 pathways to make a difference. Policy, and it isn't always about changing the law or changing regulation, but sometimes it is. We then look at program delivery, and really that's one of the most critical things. How do we better connect across programs, which means across state government, across sectors, public, private, and nonprofit, as well as infrastructure. When we look at how we deliver and silos, we all know and we do try to do better working across state agencies and within state agencies because some have many departments.
Right.
And lastly, investment. Sometimes it just comes down to money.
Right.
Is that as we have seen federal dollars be diminished in a number of areas, we have challenges trying to figure out how we're going to fill the gap here in the state. And then we think, okay, maybe we need to work differently. Maybe we need to look, is there duplication? If these programs were better integrated, and that's one of the things we're talking a lot about, is how do you integrate across departments, across agencies to better impact?
Right.
If you figure it out, let
Good
us
luck
know.
with that. Yeah, right. I was going to say
Well-
maybe you could package that up if you find that out.
Yeah,
It's been tried.
There's a number of ways that we're trying to do that in different areas of state government. I know ACCD is working on the similar issue with all the workforce development programs that they have, and how do they fit all of those together and package them in a different way.
So maybe I can just use that as a jumping off point. The Agency of Commerce and Community Development, since one of the things that people are hammering into my head as I'm entering a new sector of work is that there's so many acronyms, and I just coming out of agriculture, and people would say to me, well, what are the AAPs? And I would have to explain that the accepted ag practices are X, Y, and Z. The Agency of Commerce, along with the Department of Labor, along with the Agency of Human Services, where exist many tremendous workforce training and education programs, are all working together. And this was another charge from the governor, is looking across state government. we have significant federal resources, state resources. Some of them are general fund, some of them come through federal grants. And we have to figure out how to better meld those resources to deliver the services more effectively. So the Opioid Coordination Council has identified employment in recovery as one of the most important pathways to reconnecting with your community and having success in recovery. A job. If you have a job and you are in treatment and you are feeling valued and valuable, your pathway to success is multiplied by many, many times. And Ted Brady, who's the Deputy Secretary of the Agency of Commerce, along with Commissioner Curley of Department of Labor, recognize well that if they can look at some of the resources going through those two agencies and work with the various departments within the Agency of Human Services, then we probably can be much more effective.
I agree.
About 3 months ago, we held, and I say the Opioid Coordination Council, held a meeting and a panel on employment and recovery. And we had the manager of the Spot restaurant in Burlington and a staff person who is in recovery, the CEO of Aspenti Health and one of their employees, as well as the executive director of the Turning Point Recovery Center in Burlington, Gary DeCarolis. And all of them spoke about the power of connection, the power of supports for an employer to understand what is important for the employee. It may be attending a meeting during the day. It may be going for treatment early in the morning, which means you need to be delayed to get to work. And then for the employee, what does it mean to be supported by the employer? One of the most powerful panel conversations I have listened to and the entire Opioid Coordination Council listened to, we had the incredible opportunity to have the acting director of the Office of National Drug Control Policy out of the White House join us for this. And the governor was there for the first half of the panel as well. So I think all of us walk away knowing that if we can do more to employ people who are in recovery, which supports one of the governor's goals, is a vibrant economy with jobs for all. It's one of the goals when you ask about goals for the Opioid Coordination Council.
And who's on the Opioid Coordination Council, and what are they responsible for?
So there are 22 members of this council, and a number of people said just what you did. It sounds big. However, when you have 4 drivers of Vermont's response to our opioid challenges, so we have prevention, which includes education. We have treatment, which oftentimes includes rapid intervention. You have recovery, which has to be very well connected to treatment. And last, but always will exist, is enforcement. And so 4 drivers of Vermont's response, 22 people, really isn't that many people. A number of the positions are designated in statute. The Attorney General, the Secretary of Human Services, the acting director of the Drug Enforcement Agency, the acting director of the U.S. Attorney's Office. And then we start going to other state agency leaders, such as the Commissioner of Public Safety, who is also a co-chair, the Commissioner of Health, and then we have some at-large positions, which include a person who represents the business community and a person who represents families. We have a nonprofit housing director because in addition to employment and recovery, one of the other key pieces is having a roof over your head, having a home, having a place to go to so that you are not homeless.
And you said somebody's representing children on that, because we had a guest on, we were talking about the increase in child neglect directly related to opioid use. because it's not child abuse necessarily,
Right.
but child neglect. You're out or they're sitting in the back of a car while you're engaging, and it's just really bad.
So the partnership between the council and the Department of Children and Families,
Right.
we just had
Ken Schatz.
Commissioner Ken Schatz
Yep.
speak to the council and gave powerful testimony and connection to every aspect of what we do, since we've seen such a rise in the last number of years with the number of children who are in custody
Right.
as a result of substance use disorders in their families. We know that when you talk about treatment, it isn't just treatment for the person with addiction, it is treatment for the entire family.
Right.
So I have to say that almost everybody on this council drills down to children when it comes to the most important adversely impacted population of Vermonters whom we need to support. So whether you have an enforcement hat on, or you have a healthcare provider hat, or you are working in education, and there is a principal of a school who
good.
represents education in general, every single person coming to that table is representing the children of the state of Vermont.
I heard somebody speaking on one of the cable shows the other day, and they said their concept of what should happen, and was talking about teaching the kids early on, which I sort of thought we always used to do this, but apparently we don't, is responsibility, self-determination, understanding the importance of community early on, so that as they're growing up, maybe some of these things could be avoided if they understand the importance of being personally responsible for what they do, and the importance of community. I just thought was one of the legislators from Congressman, and I thought, wow, that is just start early. And I think we've sort of missed that along the
So
way.
when we talk about prevention, I think that's really capturing education, prevention,
Right.
intervention, and it must start early. And obviously, there are many ways of speaking to your children about what is safe, and we practice that in many ways.
Right.
We talk about healthcare consistently, but talking about appropriate use of medications and inappropriate use of medications,
Right.
which unfortunately far too many children may see in their homes or somewhere else that they tend to frequent.
Right.
It is critical that we provide appropriate language to educate. There are prevention programs in most schools and most communities across the state. One of the things that the Opioid Coordination Council is focused on is how do you better integrate these programs, because there are a lot of programs. How also do you make sure that some of the most rural regions also have access to strong prevention programs? We've got a county like Essex County, the most rural county in the state of Vermont, with only 6,000 people, and recently had the opportunity to talk to the county sheriff about some of the challenges they face, which include childcare, transportation, as well as crime, because people are seeking funds in order to support a habit. They need access to treatment, and all those pieces go hand in glove. Prevention programs will be probably the key, most important recommendation we can make to turn this curve.
That's great.
Well, and it makes a lot of sense too, because if you get to kids when they're young and teach them, like for example, the campaign against smoking, right?
Right.
You focus heavily on education, teach them young, and you can start turning the curve in a decade or two. And that's long term, I think, where the success is going to be.
You give an analogy that many other people give, and we're talking about what would a statewide messaging campaign look like, and you both well know what a campaign is. A campaign is something which has a clear, articulate message which is said again and again and again. And it can be hand-tailored to various audiences. The Vermont Department of Health alcohol and drug abuse programs do a really good job with the resources that they have reaching various audiences. And your messaging to youth under age 18 is oftentimes a different message than it is going to be for the 18 to 25-year-olds, which is the greatest challenge of a population because they're not in school anymore.
Right.
Some go to college, many don't. And you have to figure out ways to reach them.
Right.
Social media is one of the best ways to reach. And then we also need to reach our elder population. I'm learning more and more about uses and unfortunate abuses of opioids because they're being used for pain management, which leads to another topic
I just had an
of
argument
conversation.
yesterday with somebody. How much of the usage, and I think we'll talk about statistics in a little, how much of it is directly related to a physician's prescribing painkillers? Because I have a drug that I was taking, I've stopped it, but every month I had to go to the doctor and get a new written prescription so that they know I only had the 30-day. So I don't see, I think they've put a clamp on that, and I'm hoping that that's been, what are the causes? I mean, I guess, or the sources of the opioids? Is it doctors? Is it pain? I mean, where are we with that? What is the cause?
So on July 1st, there were new prescriber rules which went into effect, and there's been tremendous amount of prescriber education going on throughout the state, whether it's through the Vermont State Medical Society, the Hospital Association, our Commissioner of Health currently, our former Commissioner of Health, and many staff people across the state.
Right.
Most doctors do a very, very good job looking at how to best support the patient.
Right.
And that is prescribing the amount of prescriptions needed. We need to be cautious because we have people who are in an incredible amount of pain.
Right.
We have people who have terminal illness. We have people where opioids can be the right type of prescription. We need to make sure we do a much better job with patient education.
Right.
And for all of us who walk into a doctor's office and maybe the doctor does say, I'm going to give you a prescription for X, we need to be better able, better equipped to ask questions. We as a council have started to look at non-pharmacological approaches to pain management. And those might include acupuncture, massage, yoga, chiropractic care, naturopathic care. I mean, many things that, sitting here in downtown Montpelier, you can look at every single block and there is some kind of integrative health care opportunity within a stone's throw of here. Many people don't know a lot. Many people are searching for information to find out whether a modality such as those might provide relief for them. It doesn't mean it's an instead. It doesn't mean it supplants medication-assisted treatment for opioid use. It could provide a complement, and that's something we all need to be better educated about.
Well, I mean, I can see how someone can get sucked into that. I had 2 herniated discs in my back from a skiing accident, and it's incredible pain. Like it's pain like nothing you've ever felt, and it'll put you on the floor for a week. And and I can totally see how someone who is stuck in that kind of pain would turn to anything that stops it, anything that even takes the edge off. And if that's opiates, I can totally see someone going that direction. Or even if their doctor does prescribe something like Oxy or whatever, and then getting hooked on that. And fortunately, I never had to take anything that serious of a painkiller. Anti-inflammatories were enough for me to manage it, along with chiropractic and other stuff. Were enough to manage it in my case, but I can totally see how someone can get sucked into that.
Yeah, but that's up to the doctor to watch you and to understand where, because my husband's going in for surgery and they handed him about 4 pages on this exact topic about this is your choice, but you have to be careful of. It just went on, and of course Bruce is a retired policeman, so he's looking and he's going, oh, maybe we won't take this. I said, well, I think you're going to need it, but you've got to have work with the doctor to make sure you're taking when you need it and the right amount.
Well, we're also in a society that's moving 150 miles an hour. So we're handed new guidance documents sometimes 3-4 times a day.
Right.
You search the web and it's unbelievable, the wealth of information. How to navigate your way through that volume of information is sometimes really challenging for a lot of people, which actually gets to case management. When people live with substance use disorders, one of the most important things is that you have someone connected to you. And oftentimes that could be a recovery coach. We're exploring the expansion of the use of recovery coaches. The Vermont Association of Mental Health and Addiction Recovery, which used to be the former Vermont Association of Mental Health and expanded to include addiction and recovery a number of years ago. They run a recovery coach program. There are over 350 recovery coaches.
That makes a lot of sense.
It does.
Yeah.
Because you're talking to somebody who's been there, done that, and hopefully been successful.
Well, it's also about accountability, because it's really hard, even for a family member who's, it's really hard for them to keep someone accountable, because you don't want to jeopardize the relationship or whatever.
Right.
But if you have someone else who's not a family member who can step in and say, here's what you need to do, and won't, sugarcoat it.
Or more importantly than here's what you need to do, sometimes it's here are the options.
Right.
Here's the pathway towards recovery, which must include treatment, and I think that's where you're saying, I mean, if you can stay in treatment and you have wraparound supports, your opportunity for success grows tremendously. And then, as we talked about earlier, if you have children in your family, how do I find the resources to keep my home? How do I find all the healthcare supports that I need both for myself and my family? How do I get transportation? And I will say there are many, many programs that do exist. Recovery centers, which exist in every single county in the state. And when I say county, there is usually only one recovery center. However, people who are connected to recovery centers will help you wherever you live. They'll help you get transportation to the recovery center, which is a place you can discuss anything you want with peers. You have access to healthcare resources and any other kind of support.
I think navigating through this system is so confusing. I know, well, actually, any department I worked in state government, people don't know how to access whatever the services are. But this is, I mean, how do you get people, first of all, to agree, and then to go through and be successfully led through the system?
Pat, I think you just nailed why I agreed to take this job, is because it didn't matter which sector I worked in. And, transportation for you, motor vehicles, natural resources. I think I have a partial list of how many various sectors you worked in. And it doesn't matter which one it is. What you said, there are so many resources to try to find the portal for entrance to access resources, or at least find a human connection. That is the key for people who have substance use disorders.
And it's not may I just be so bold, it's not the website. Everybody's creating these one portal, and the people that need help a little bit are not in the mindset to sit in front of an IT screen and try to sort it out. They need somebody to help them, somebody to take their hand and to encourage them along. That's my 2 cents here.
You do. You have to find them. So I will make a plug right now for 211. While 211 is not as robust as it hopes to be, it has grown tremendously. The governor has 211, and it's 3 numbers. So everybody can remember 3 numbers. It's like 911, but this is 211. And it is your statewide access to information, resource, and referral. Governor Scott has 211 right on his website. The health department has 211 right on their website. And so does the Agency of Human Services, so does the Agency of Transportation, and the list goes on and on. There will be a person who will answer 211. And they may not be the person who will give you the resources that you need, but they will be able to refer you to that person. And you're absolutely right. If you're picking up your iPhone or you're trying to find a phone number, you know, an 800 number is hard to remember for all of us. And finding the right website when 10 come up on page 1 is also hard. 211 works.
Awesome.
And I'm sure if you're looking for help for opiate, you're not in the mindset to go through those 10. You want one person to tell you, you know, Ben, here's what you need to do and I'll help you. That's all you need to say. If they hear the word I help you, you got them.
And to walk through. So you were appointed in January. How much did you know about the opiate crisis coming into this job? And, you know, 9 months later, what do you know about the scope of it, or what do you see the scope of it being now?
So I knew a little. I think most people in Vermont, most people anywhere know a little. Somehow opioid use and abuse touches your life. The governor says that there are no socioeconomic dividing lines for this challenge. Some people call it a crisis, some people say it's an epidemic. I learned more and more quickly in this job than I ever have in any other position that I have held in my 35 plus years in public service. And most of my career has been in public service. When I took the job, I thought to myself, I'm a really good orchestrator. I'm good at puzzles. I'm good at building relationships and talking to people about what is the challenge. I'm good at asking questions, which is one of the key things that you have to do here. Where are the gaps? Where are the opportunities? Where are the best practices? The governor had already identified that Project Vision in Rutland is a very strong community-based initiative which brought people together from prevention, treatment, recovery, and enforcement. And they did so because there was a crisis. There were challenges facing the city and the outer city limits that were impacting people everywhere, on playgrounds, in downtown areas, in housing properties, and in places of business. So convening that type of community-based effort works, and it continues to work. And some of it is volunteers. Some of it is using resources. They weren't new resources. They were realigning existing resources.
Right.
With that said, I realized also very quickly this is about as complicated of a problem as anything I ever thought about. Healthcare and the healthcare delivery system, from federal resources to state resources to your primary care provider's office, it's complicated. And to have effective program delivery, it means that you have to break down silos. You have to effect change, cultural change, because people have to work together differently. I've been so impressed with the people at the community level who understand, because you have somebody who might be 17 years old walking into a primary care doctor's office saying, I have a problem. Or a doctor having to say to the 17-year-old, I think maybe you have a problem. And then they start to talk. The Hungry Heart, which is a documentary
Seen that.
by Bess O'Brien, who is a filmmaker from the Northeast Kingdom, one of the most powerful first films that I saw. This is what I do on Friday nights. I either open up a book about addiction, or I read website information, or I watch this movie. And it was about people in St. Albans, Franklin County, and a doctor named Fred Holmes, who has since retired, and about the promise, the hope to take treatment opportunities and then go into recovery. it also talked about the power of family supports, because if you don't have a family or friends or some kind of community-based connection, it's really tough to be in treatment and recovery by yourself.
Right.
Absolutely.
So, you know, in the first 10 weeks, one of the charges from the governor, and that was my second day on the job, Governor Scott held his budget address, and in it he announced that there would be a summit on Vermont's substance use disorder workforce, identifying the fact that there are not enough people in the substance use disorder healthcare workforce. Numerous reasons. The pay. When you work for a small community-based nonprofit,
Right.
and you have just finished your first 4 years of college, might walk out the door with a degree in social work, maybe you've gone on to get your master's in alcohol and drug abuse programs or mental health. The pay in these small community-based nonprofits is not great. So you may choose something different, like going to work for a larger hospital or going to work for the state of Vermont. So affordability is an issue. Then we get to professional development. People in the substance use disorder field need professional development. They need supervision. They need supports. It is tough to do this kind of work, 8+ hours a day. And many people who work many more hours a day than 8 hours a day. And then we looked at licensure, the role that the Office of Professional Regulation in the Secretary of State's office plays, managing, I believe, 150 licenses across the state of Vermont, 9 of which fall into the alcohol, drug abuse, and mental health arena. All of this is new to me. And it was new to many people as we brought together, again, people across enforcement, prevention, treatment, and recovery. So the governor's charge was, okay, all of you who want to design better pathways, come together with higher education, because licensure must be aligned with higher education, and see if you can figure out how to address challenges and start to build a pathway to better opportunities. In 10 weeks, I worked closely with the Department of Health and the Vermont State Colleges. They received the direct charge. We pulled in UVM, we pulled in other independent colleges, we pulled in alcohol and drug abuse and mental health professionals from across the state, and we designed a conference that had 160 professionals at VTC on April 17th. And I'm very proud to announce that 5 months later, we are about to announce change in one of the most important licenses, streamlining and better alignment with higher education. And that will be announced by the governor and the Secretary of State next week.
And this will encourage more people to come into the
field.
Good.
And it will allow employers, hopefully, to have a larger group of qualified applicants.
Great.
And that's one of the keys.
Excellent.
So we've heard a similar story on the mental health end of it also, and these are closely related issues, where designated agencies even, and for our viewers at home, designated agencies are typically funded by the state. They have some private funding as well, but to go out and provide a lot of these services at the community level. But they're having similar issues with being able to recruit qualified workforce, being able to pay them well. And I think everyone seems like they're trying to figure out how to do that.
And they're sort of stealing from each other too.
And they're stealing from each other,
and it's just people want to go where they get paid. So you can't blame them for that. But Mary says Mary Moulton, we were just talking about it, it's a real problem for them, and I think they got some financial help in the budget, I think this year, because they made a compelling argument about what's happening.
Well, there was something like almost 50% of their positions were open or vacant, and
so how can they do what they're
they can't even
do?
function on that level.
Do you think you're going to get a lot of support from the feds, because they are talking about national crisis, and I think they realize, those that have been on the news, they realize how serious this is. Do you think you're going to get some support? Oh, look at the face. I'm not sure. You're not sure?
I'm hopeful.
I would think so.
I can't really say anything more than that. I think we have budgetary challenges which are significant at every level of government, whether you're.
And how do you set the priorities, I suppose? But I think the federal government, from what I've heard, really gets the fact of this is a national crisis, not just one state versus the other. It's everywhere.
They do, and I think the president listened to governors across the nation who are experiencing this firsthand. So Governor Scott was one of the very first in his administration to come out with an executive order saying, we have got to do better than we are doing right now. We have got to better integrate services, programs, resources across state government and deliver them to the people and communities who need them most. Governors of Massachusetts, governors of North Carolina, Governor Christie, who is the chair of the President's Commission addressing opioid use and abuse, they all fully understand that this is an enormous challenge. The National Governors Association has taken this on as one of its top priorities. Answering your question, I can't answer that question because I think that the pressures that exist on all human services, education, healthcare programs are significant. What I hope is that we will see an analysis of program dollars, resources, across federal agencies, and whether it rises to the level of funding for a national campaign, which then Vermont would be in a much better place to work from that template and hand tailor it to our needs. Something like that I think is critical. I just want to mention treatment because the President's Commission has issued an interim report, and they highlight treatment on demand, treatment more readily available for every state in the nation. This is one of the areas that Vermont is doing really well. Is it perfect? No, nothing's perfect. But we have a system of treatment delivery through our hub and spoke model where there are designated agencies, there are hospitals, and there are many, many primary care doctors in every county in the state who provide treatment for substance use disorders in general and opioid use disorders in particular. And I think the state of Vermont over the last decade has done a tremendous job. It goes back to Governor Douglas, it goes through Governor Shumlin, and Governor Scott has made it very clear that his purpose is to strengthen what already exists. Vermont has made a commitment to this, and we are nationally recognized. That was part of the reason why the national director of the office
came here.
Came here.
That's great. So we have a system already set up, and your charge, I guess, is to look at that system to improve it where there are gaps. And is that what the committee, the council is looking at? Is where are the gaps? Where can it be improved? Because it sounds like there is a system in place.
There is a system in place, and it works.
That's great.
It doesn't mean, going back to something you were saying earlier, Ben, it doesn't mean you, at a moment in time when you are ready for treatment, know how to access that treatment. And so one of the many things the council looks at is how do we improve access to treatment at that moment in time when you are ready.
And that's one of the things I've heard is you have to get to that person at the right moment. There's a certain period of time where something happens that person's open to treatment, and you have to get to them in that window. Someone has to get to them in that window, and get them access to treatment, or that window closes at some point, or could close.
Or you are in treatment and you relapse. And that's where I go back to the recovery coaches, is that if you have that person who stays connected with you, you might reach out and make sure that you at least are able to have a conversation.
Because once an addict, I mean, you really have to guard against it recurring your whole life, right? I mean, it's there. I don't know if that's true. That's just what I've heard, that once you're in it, the desire's there. You have to work really hard to fight back.
And some people I know, even they haven't been a substance abuser, but they've had parents or relatives who are substance abusers, and they are, even things like they won't drink because they've had a family member, not because they've had an issue, but because a family member's had an issue.
Yeah.
Most people who live with addiction will tell you that they think about it and work at it every single day of their lives. There are a few people whom I've heard who feel like you can actually be recovered. And I think that that would be a conversation for another day, where you invite a couple of people who are in recovery to have this conversation. What I appreciate about people who are in recovery is how open they have been talking to me and talking to many people about living with addiction. What are the challenges? What are the pathways to recovery? And I just want to kind of veer to talking about stigma for a minute, because people who live with addiction, or families who live with loved ones who experience addiction, it's hard oftentimes to talk about what is happening in your life. And I was incredibly heartened and proud to be a part of an opioid overdose awareness day at the State House last spring. I think it was the first time there was ever a media event focused on opioid overdoses.
What did you have there? People talking about it?
Absolutely.
Really?
There were too many speakers, so that's a good problem to have, because you're always in a tight time frame, and the governor was one of the first speakers. It was Representative Vicki Strong from the Northeast Kingdom, who had met two women who lost son and brother respectively to opioid overdoses within the past year.
Oh my.
And she became educated. And going back to the education, part of it is listening. I'm looking at listening beyond the sound bites.
Right.
So much of this work is about listening to what people are wanting to talk about. And part of that is making safe places for people to talk. So Representative Strong brought together these two women. We brought in the Howard Center, which hosts Safe Recovery, which is a needle exchange program. There are 6 or 7 needle exchange programs in the state where people who are actively using opioids can come and exchange their needles, and also receive case management services. Again, a place you can talk about the potential for treatment and recovery. And so we had law enforcement at this press conference. We had these two moms who talked about their experience and the need to have more family support groups across the state. Again, finding family support groups, they are not the easiest to find. I've had a number of other parents or peers, loved ones of people who have died as a result of opioid overdoses, and people need to talk.
Right.
So we're going to do more to make sure that the portal to access resources is more readily available.
I support that.
I want to go back to
100%.
one thing you said. So needle exchange programs years ago were controversial when they were first, started becoming popular. But I think it's a great example of public policy and how public policy can work long term, because a lot of people view needle exchange programs as enabling or or whatever, but they act on several fronts. From a healthcare perspective, it makes it a lot safer, even though you're not discouraging necessarily the behavior or the usage of illegal substances, but you're making it safer to do so. You're also creating a portal. You're creating an entry point into treatment services, because you're building a relationship. And that's why I think we've seen those types of programs be so successful, to the point that UVM, when they had some extra money and they were looking at where do we invest this for global health, they put it into a needle exchange program because that was the best return on their investment.
Yeah, I think those things are so important, and it's great that the people that are exchanging recognize the risk they're in and want to do something about it.
Absolutely right. That's one of the topics for potential recommendation to the governor, is that there are 7, which means that there are a number of counties which don't have needle exchange programs. Many communities are willing to invest for exactly the reason that you said, is there is a return on investment.
Right.
We need to look at the data, and there is a lot of data available on the health department website, and that's something in a future program we can dig more into. Right. I want to mention, since there are these needle exchange programs and we know that they are effective, there are also drug disposal and sharps disposal opportunities. And I want to go back, you mentioned that you had Mary Moulton from the Central Vermont Substance Abuse Services here.
Yeah, mental health services.
On your show.
Yeah, right.
Central Vermont has done a really good job, Barry in particular, talking about needles after every winter. You know, the snow melts and you go on a plate.
Green Up Day, that's a eye opener.
Green Up Day, there you go.
Whoa, they give you boxes to put these things in there. You can't touch them. You have to call the experts over to even touch these things.
Well, it's
really,
you know,
they're everywhere.
Safe disposal is really important.
It's really key. It's very, very key. And it's, you know, one of those things that, you know, proper disposal is if you're just not properly disposed of public health risk, because who knows, kids be playing on, you know, just walking down the street and they go grab something out of the bushes.
Done.
And, you know, and so there's, you know, it's one of those things that is scary when you really, you know, look at it.
Right. So hospitals, law enforcement, many local nonprofit human services and health agencies are all coming together, and Barry is leading the way. They're going to come up with siting for kiosks where you will be able to deposit sharps.
Great, good.
And I think you also talked about stigma. I want to revisit that briefly. It's interesting, I think, because the mental health, more generally understood mental health issues, there's been a lot of movement on the stigma surrounding those diseases. And there's been, I think, perceptively anyway, less so around opiate abuse and you know, addiction. I think because perhaps some people view it as a choice, like people are choosing, even if they're, you know, they have a tendency towards addiction, they're still making a choice whether or not to use that substance. Right. Do you see any change in that or in that perception of, you know, how people are perceived that have addiction issues?
I think we have a lot of work to do with that. One of the best and most impactful presentations I think I have seen in my life was presented by Dr. Sanchit Maruti, who is a neuroscientist from UVM Medical Center, and he is part of the addiction treatment program run through UVM Medical Center. He shows you the science of the brain, and he gives you a number of slides which show before use of opioids and after use of opioids. He talks about the impact on the developing brain under 25. Some people actually say it's still developing up to as late as 30, but certainly under 25. And there is a change in your brain. There are numerous scientists who will talk about people who have more of an inclination towards using substances in the first place. And this is one of the areas that, again, I will point to bringing Dr. Mark Levine, who is the new Commissioner of Health, possibly bringing someone like Dr. Sanchit Maruti on this program.
I think this is something we'd like to follow on this show, because I think people need to know what's going on.
Your brain changes. And I think that is something that all people need to understand. There's a moment in time where it's not a choice. You don't just flip a switch and say, stop. You need help. You need treatment. you need people who will connect with you and help you along that pathway. And I know many, many smart people in my decades of life who are just learning that. And in part because I'm a parent. There was not parent education when my kids were growing up 20 years ago.
We heard the thing, pick yourself up by your bootstraps and cut it out. Yeah. That's what we heard, right?
And we knew more than our parents did. Yeah. And your generation can know much more than we did. I think this is a responsibility we have, and I see this as a really critical charge that the governor has given to this council, is that prevention is about messaging. It's about public awareness. It's about making sure that when you enter school, messaging begins pre-K and it doesn't stop when you graduate. It also means that if you are a pregnant woman and for whatever reason you have a substance use disorder, the day that you go for care, you hopefully will enter treatment. And most women who are pregnant with opioid use disorders are in treatment. We have to do a better job dispelling the myths. And many babies who are born who have mothers who live with addiction, it doesn't mean that the baby is born with addiction. It does mean that mother and child need continued supports.
Yeah.
So we have about a minute and 46 seconds. And we were going to talk about statistics, but if you could send them to us, what we'll do is put them up on the screen so we know they're current and accurate, the number of Vermonters that are dealing with this. And I think the last one is, how much is it costing us as taxpayers? Is there any way to, what is this epidemic hitting us in the pockets? That's probably after all of this discussion.
Well,
but we're paying for something.
Well, it's not just the state dollars also, it's also healthcare. Right? There's healthcare dollars
the
involved
ripple
in this
effect.
also, yeah.
Let's just say that we are in the hundreds of millions of dollars. And you are absolutely right. It's the cost of treatment is high. The cost of not providing treatment would be much higher. And if we can do a better job providing strong prevention programs and messaging, and a better job providing wraparound supports with recovery, we may someday be able to reduce the costs of treatment.
Well, now's not the time because we've got a serious crisis. I think you've learned a lot in the last few months, and I'm expecting a lot of great things from you and your committee. So we'll have you back. I'd like to make this a priority for us on the show, because I think people really want to understand, because it impacts all of us. Somehow, you may not know it, but it's impacting us. So.
And I think there's hope, because you look at the success of a campaign like the Campaign to End Smoking, and you're dealing with similar issues there. They're more complicated perhaps, but similar issues, and I think there is hope.
And that was a successful campaign.
Someone
really,
in my generation, I mean, we talk about this now, like, you look at someone who's smoking and you go, how can they make that choice, or how can they be doing that? And I think there is hope.
So thank you, Jolinda, very much. Thank you, Ben. Thank you for listening in. We'll see you next week. And in the meantime, keep listening beyond the sound bites.